Okay, it's 5 o'clock. I'll call the meeting to order to the St. Croix County Board of Supervisors. And at this time, if we'd all rise, we'll have a short dissertation from Mr. Sackett.
Is this ready now? Okay. Thank you so much. I've been here quite a few times, and it's always, I get a little shaky and nervous. It just, it's good to consider you friends of our public and someone in authority. You have a lot of responsibility, and we appreciate that you are here because you care about your community and about our county. It doesn't matter whether it's something huge or something small. It all comes through you to administrate and delegate some responsibilities. And I often think about the fact that we are not on our own. We are dependent people. We always have been. Even the people that founded our country fought for independence, but they always knew that we as a nation were still dependent. And they wrote specifically that they were dependent on God, our Creator. And with that, let's pray. Lord, we are thankful that we are an independent nation. But we have to always remember that we are a dependent nation. Our county, our communities, our families, everything that we are a part of and that is a part of us is dependent upon you. You are God, you are our Creator, and you are involved. No matter how much our nation would want to push you away and do our own thing, you know that at the very core, at the very heart of every human, there lies enough wickedness and enough rebellion that without you, we would swiftly and quickly fall apart. So we thank you that you are involved in our lives. You're involved in the people in this room. And as much as we want to be a nation of independent people, help us, remind us that we are a dependent people. As citizens of this county, we are dependent upon the people in this room, making decisions, hearing our causes, taking up our cases, and deciding what's best for all. It's not always perfect, but it's something that we can do on our own as a nation, to choose to vote, as we will in just a few weeks, make our choices as to who and how we are led by our human people that we chose, our representatives. But help us again, remind us again how dependent we are upon you. And the people in this room, they are dependent upon you too. So we thank you for being here and being everywhere involved in our lives. In Jesus' name, amen.
For the agenda this evening, before we start the public comment, we did have a presentation by Dale Knopp of Wisconsin Counties Association. I'm going to let him proceed with his presentation. It shouldn't take too long, and then we'll move directly back into public comment. So Dale, are you ready to go?
You want me to do roll call?
Oh, I'm sorry. Yep. First, we'll have roll call.
Ed Schochner.
Present.
Sean Anderson.
Present.
Bob Long.
Present.
Kathy Leaf.
Present.
Kara Cook.
Present.
Tim Hall.
Present.
Paul Burning,
Present.
Rick Otino,
Present.
Bob Fiedler,
Present.
Dave Osnes. He's here. Okay. Scott Coner. Dan Hansen.
Here.
Scotty Yard.
Present.
Greg Telejohn.
Present.
David Peterson.
Here.
Paulette Anderson. She's here. Yes, I see her. Judy Achterhoff.
Here.
Shelley Tomschick.
Present.
And Bill Peavy. See him? Okay, all right. 19 present.
Okay, is Dale?
Yep, welcome Dale. If you want to take off, he's got his screen share going there.
There we go. Yeah. Okay. So thank you. It's good to be here this evening. Just so you know who I am, I'm Dale Knopp. I am with the Wisconsin Counties Association. I am the Director of Research and Analytics there, and also the Director of Forward Analytics, which is the research arm of the Counties Association. We started this research arm in 2018. Prior to me coming over to the Counties Association, I spent 18 years with the Wisconsin Taxpayers Alliance as their research director. And so our mission at Forward Analytics is sort of twofold. One is to publish research on big picture challenges that the state is facing. Sometimes it focuses on counties, sometimes it's statewide, but trying to raise and address some of the big issues the state faces. The second part of our mission is to help county officials with their data needs, information needs, anything that we can help them with sort of on the data front. We've been doing. So on that note, before I get started talking about the what I think is really the biggest, one of the probably the biggest issue facing the state over the next 10 to 15 years. I just want to give you an update on sales taxes. We just sent out sales tax projections a week ago, and we've been tracking them, all spring and summer, trying to provide some updates to county officials on them. St. Croix has been one of the beneficiaries. St. Croix County has been one of the beneficiaries of some of the shift in patterns in terms of retail sales. So I just want to just touch on that very briefly. Through September, payments to counties for the sales tax are actually up 2.3%. You go back to April and May, we were expecting them to be down, a fair amount. They're actually up. St. Croix counties are up 13.3%. So well ahead of last year. And we're seeing a lot of smaller rural counties with similar increases. The gains really have been, I think retail sales have held up because of the Fed stimulus in terms of the $1,200 payment and the $600 federal unemployment boost. So that has sort of supported retail sales through through July. So it's sort of unclear where we're headed going forward. But if you haven't seen the sales tax estimates, we are projecting St. Croix County to be up over 10% for this year, coming in over 10% compared to 2019. And we're expecting very modest growth in sales tax collections. Overall, next year, but we're expecting patterns to begin to go back toward where they were prior to the pandemic. Not completely, but start moving back. And so we are expecting St. Croix County to probably be down a little bit for next year. And that's because, again, you're at a much higher base this year because of the big gains. But I'm not expecting a lot of increase for next year. So that's the sales tax update. The main reason I'm here, Bob Fiedler asked, he saw me talk about some of this stuff at, I believe he saw me at one of our conferences. One of the biggest challenges facing this state over the next 10 to 15 years is our demographic problems. And it's going to create significant workforce problems. And I want to sort of talk about that and sort of walk you through that really quickly here. This is a picture of what the growth in our workforce looks like, given what we knew about our demographics in 2010. So our workforce, we have the working age population on top, the workforce on the bottom. The growth in our workforce really started flattening out after 2000 and really since 2010. And based on our demographics, as of 2010, our workforce essentially is not going to grow for the next 20 years, which, you know, is going to have a big impact on the economic success of this state. And as challenging as this graphic is, I would argue the situation is even worse than that. The reason is we're already below these projections. So the projections came out in 2013 based on 2010 census numbers and information that they had, up to that point. The state is down already in terms of the working age population, about 64,000 people from what was projected for 2020, a 1.7% difference. The 5-county region of St. Croix, Pierce, Dunn, Barron, and Polk counties, down about 7,400 from what was projected, or 4.3%. And St. Croix County down about 4,500, or 7.6% from what they projected. So we're looking at we've been looking at sort of a flat workforce over the next 20 years. Given what's happened since 2010, we're now probably looking at, over the long term, unless things change, a declining workforce. The reason there's an assumption in these forecasts that when the Department of Administration made them, that migration patterns were going to shift and move back toward the 90s, and we'll see that picture in a minute. And that birth rate, and that would affect the current workforce, and birth rates would turn up after 2013. They had been declining for about 7 years up till when the projections were made. So this picture shows what the Department of Administration was expecting migration patterns to look like. So between 2015 and 2020, they expected 112,000 people on net to move to this state. Again, mirroring kind of what was happening in the 1990s. And after that, another 95,000 between now and 2025, and then another 85,000 for the 5 years after that. If you look at what's actually happened, we have an improvement over what's been happening over the last decade, or last 15 years, but actual migration 2015 to 2019 is only about 7,000 people on net. So we're far from what was expected. And that's one of the reasons that we're seeing the population numbers, the working age population numbers, come in less than what was forecasted. And that's going to be one of the big challenges that we're facing. And what's behind this is we looked at migration by age groups. We were curious to see, where is it that, we're losing people? And so we looked at age group migration. So in other words, we looked at the 20 to 29 population in say 2000, and then looked as they aged through the next decade, what that population then looked like when they were 30 to 39. And when you look at that and then take account of deaths, you get a net migration number. And as you see, the three bars here are for the different age groups for the 1990s, the 2000s, and the 2010s. And what you see is we have historically been fairly good at attracting young families. Those in their 20s aging into their 30s, those in their 30s as they age into their 40s. If you notice, these numbers have been positive historically. During the 2010s, we actually lost almost 24,000 people who were in their 20s as they aged to their 30s. And we've lost 12,000 people from their 30s as they're aging into their 40s. And we've lost almost 24,000 from in their 50s as they age into their 60s. So something has changed in this state that has made it less attractive for young families and middle-aged families, really, to move here. And we're not exactly sure what's driving that, what's behind that. But it's out there, and we need to figure out how do we get back to the 90s and the 2000s when we were bringing in those young families. Because what we're going to see is that has a long-term impact as well. What does the 5-county region look like? Sort of the same pattern. The young, the 20-year-olds as they age into their 30s used to come into the region, now lost 2,900 of them. The 30 to 39-year-olds as they age to 40 to 49, 4,000 to 5,000 over a decade. Now it's less than 1,000. So a little bit of positivity in that we're not, at least not negative in one of these, but pretty much the same trend as the state. And then we move to St. Croix County, where things are a little bit better. We're still seeing gains in really the two of the key family formation ages, but the gains are less than what we've seen historically. One of the things that we're seeing, and what you noticed is, may have noticed, is this 10 to 19 age group to 20 to 29. The way you want to think about that group is high school students, middle school, high school students, as they age into their 19 to 20 to 29, their college years. Places like St. Croix County, places like this region tend to lose a lot of them as they go off to college. And more, they're not coming back to their home counties. And that's one of the reasons northern Wisconsin has really been devastated over the past decade, because most of the universities are in the southern part of the state. And so they're going to the southern part of the state to get their degree, and they're not coming back. So what's the impact of not having young families migrating to the state anymore, oftentimes they bring with them children. What you see is, here is, again, Wisconsin, the region, and St. Croix County, the number of kids who were, if you look at the under 10s as they age into their teens, we were getting 53,000 statewide in the 2000s, 7,000 in the region, 2,400 in St. Croix County. All of those numbers over the past decade are significantly lower. And in fact, in St. Croix County, they've turned negative. You want to think about this group as that's a significant part of your workforce for the future. And so you really don't want to see those numbers declining like that, because that has very negative implications for your future workforce. The other challenge, as I mentioned earlier, that we're facing is that births continue to fall in this state. Births have gone up and down, since 1990. They've been declining since about 2007, 2008. And again, in 2013, they thought they were going to turn back up and start moving up again. Unfortunately, they haven't. They've continued to move down. The 64,000 number in 2018 is the fewest numbers of births in this state since 1973. And we're seeing this, all over the country. But again, that says something about your future workforce, the future workforce in the state, 20 years, 25 years out. And so that's not, that doesn't provide a lot of optimism for the size of our future workforce. So I guess the point is that we have a significant population challenge or workforce challenge as we're going forward. And since it takes, there's a common phrase among economists that it takes 20 years to create a worker. By the time the births in 2018 really enter the workforce, is not going to be until 2038. So the population that we have now, is our, we know roughly what our future workforce is. The only way to change that in the medium term is to shift migration patterns. And we've talked to legislators about this, about thinking about how do we get that, how do we turn that around. With COVID, everything is on the back burner right now. But I would argue that it's not the solution, but it can be part of the solution. And that is, COVID has changed something. And it may have changed something significantly in terms of the workforce. And that is this surge in telecommuting, that wherever we've been able to telecommute, we have telecommuted. And what businesses are finding is they've historically been relatively hesitant about it. They're finding that it works. There was a study from the Federal Reserve of Atlanta. They do this survey of business uncertainty. They did this in May and early June. According to their survey, based on their survey, they're estimating that when this is over, so think about a year or 2 years out, there's going to be roughly 10 million additional full-time remote workers across the country. and 10 million additional part-time remote workers. Now, these full-time remote workers basically can live anywhere. Part-timers have more regional flexibility in where they live. So they, in your case, working in Minneapolis, maybe they don't want to fight the traffic, and so they're living, near the city core, in the city core. If they're able to work part-time from home, they can essentially move further out because they only have to fight that commute maybe 2 days a week or something. So there's going to be a shift, I think, in where people live, and we could be on the forefront of attracting a significant number of those people. Vermont is already there. Vermont started a couple of years ago a program where they're offering telecommuters $10,000 to come to the state and telecommute, and there's some strings attached to it, but in the short time that it's been in place, it's been fairly successful. And what they're finding is with these telecommuters, they typically bring a spouse and they typically bring children. And so, it can be an advantage for a community. It can be a way to possibly, spark our commuting or our migration patterns. Now, there are some early signs that this might be real, and it's way too early to tell. And these numbers, might just be a blip that we're seeing. But I was part of a real estate panel the end of last week, and one of the presenters was showing nationally single family starts, and he broke it down by large metro counties, suburban counties, etc. And the large metro, the suburban counties and the large metro areas in Q2 of this year down 9% to 17%. But when you go, this is single family housing starts, but when you go to the small metro areas, the outlying areas, they were actually up. In Wisconsin, home sales, June through August 2020 versus 19. Statewide, they were up 13%. Urban counties, they were down 0.5%. Rural counties, up 13.2%. And the same thing you see with building permits in April to June. Rural counties, less urban counties are at this point are seeing a slight resurgence. Again, it could be a blip, but I'm more and more convinced that there's going to be a significant shift in where people live, where many people live, because they're not going to be tied to their where their company is. And we have so many great amenities in the state, from our natural resources, we're a very safe state. We have high quality schools, etc. So we're a very attractive state for many of these people. And I think we need to think about how do we go about making sure that these remote workers know we're in play and know what we have to offer. The one thing that we need, though, the one thing that we need that we're not necessarily great at, and that's broadband access. This goes back to the 2018 numbers, which were put out in 2020. Overall, in terms of broadband access, 93% of the state has 25 megabit access, 29th in the country. We're great in our urban areas. We're not so good in our rural areas. And St. Croix County, we're working on a rural broadband study, and I was somewhat surprised at St. Croix County's numbers in terms of rural, but this just really backed it up. Overall, the urban parts of St. Croix County could be a little bit better, but 89% coverage. The rural parts less than 50% coverage. And when you look around the state, there are pockets of the state that we need to really figure this out. If we want to be in this market for these relatively high earners, oftentimes with families, moving here, paying taxes here, supporting our public services, we need to make sure that we have broadband access throughout the state. So with that, I'll stop, and I guess if there's any questions, I can certainly answer them, or hopefully answer them for you. It's a lot of information there, I know.
Thank you, Dale. Some really good points there. So any questions for Dale?
This is Supervisor Hall. I have a quick question. So when we look at the drop in migration into Wisconsin, is that applicable to St. Croix County? And what are some of the factors that are causing people to not come or to leave early? Is it quality of services? Do we have any information on that?
That's one of the big challenges. There are no surveys of people that have moved and asked them, why did you move into the state? Why did you move out of the state? So, we tend to look at other data or to try to get some sense. So historically, what we thought was, when we looked at the data and we saw we were attractive, we weren't necessarily attractive to the very young, to the college age. They tend to graduate college and leave. But the young families, we historically saw moving here, and so we tied that with our really good public schools, low crime rates, those kinds of things, and you get a sense that that's probably one of the reasons that young families were attracted to us, and young families weren't leaving. Something has changed. And you could see it start to change in the 2000s, but something radically changed after 2010. My theory, this is just totally a theory, but the only thing that we can come up with that changed was, in 2011, with all of the turmoil in Madison with Act 10 and the national coverage that we got with that over the next several years. It was a lot of very negative coverage of the state. If you were somebody from Illinois, Southern Illinois, from Indiana, from wherever, seeing that coverage, and you were considering moving, it wouldn't have been one of the places maybe that you think about coming to. And since then, again, because we're a purple state, every election, we get, the press in terms of, and sometimes it's not as flattering. So I think that it can't explain it all, I don't think, but I think that probably played a role in the shift. But there's something else that's going on that we just, at this point, we can't figure out exactly what it is.
Just one last question, and then I'll leave. How are our neighbors across the river doing in this? Actually, Minnesota's doing a little bit better. The interesting thing is when you looked at, so when I first did this study, we only had data through 2015. Illinois, from 2010 to 15, lost population in terms of migration across every age group except one.
and that was the 20 to 24-year-olds as they aged to their late 20s. So they were attracting young college graduates, but then every other age group, I mean, which is unheard of, but every other age group was leaving. Minnesota, in many ways, is very much like us, but they're, because of Minneapolis and the size of Minneapolis and the kinds of companies that are there, it's still an attractive area it's obviously a very attractive area to young college graduates, and it's an attractive area for young families. So, they're doing a little bit better than we are.
Thank you, Dale.
But
Dan?
but overall, I will say, the net movement overall between the two states is about dead even. So it's about a net zero when you look across, all age groups.
Okay, thank you. I think we probably, one more question here. Scott, go ahead.
You were talking before about the internet access, and the rural areas are kind of down in St. Croix County. How do we compare with like Polk and Pierce counties? And I know about 10 years ago they were working on programs in the northern counties through like cellular service that was being platted out to improve their internet access. Do you have any information on that?
Yeah, well, that was the one thing that really stood out to me and surprised me. In terms of the study that we're going to be putting out here, within a month or so, was St. Croix County in terms of 25 megabit access was one of the worst, if not the worst, counties in the state in terms of the rural areas. That surprised me. But so Polk County better, in terms of that. I don't remember off the top of my head how each one of those are doing. Wisconsin has had, in a number of counties, really good success with the fixed wireless approach. Kewaunee County, a significant portion of that county gets their broadband via the fixed wireless. So I know that approach is being taken in a fair number of places, and it's been fairly successful.
Okay, thank you. I think we need to move on to public comment here. We've got a lot of folks waiting. So Supervisor Osnes?
Thank you, Mr. Chair. Just to let you know, we do have overflow room is completely full. Overflow 2 is completely full, and the folks in overroom 2, there's a 30-second time delay, so I would respect that if you call any of those names and they don't show up right away, they may be coming down from the other end of the hall.
Thank you. Okay, at this time I'm going to open public comment, and the first name I have here, they're in random order. Heidi Duth. Heidi Duth. I also want to mention that we're allowing 2 minutes per comment.
Does that work? Okay. Is this okay? Okay. I just want to thank you for having me, and thank you for serving us. And I do want to just give you all a really big thank you, because I've been tuned into government more lately, and it feels like you are a very responsive county. I feel like people have made their voice heard in relation to mask mandates, or maybe that was the city, but in the health ordinance, you tabled something that the community had a strong opinion about, and I felt like you listened. And not so much in Pierce County. I go to church down there, so I had interest there, and that's what kind of perked my ears up when I saw how hundreds of people could show up, and then people wouldn't change their votes and listen. And I feel like there's kind of a classicism almost that happens where when we say follow the science, only the favored science is followed, even though there can be differing opinions. And I just was wondering if a minority opinion can have a voice. If we, in America here, I think that we're always going to have differing opinions, and that's why we have a legislative process. And that's why I encourage you, if this mandate comes up again, that you would put it out for the people to vote. These are the members of the county. We were just talking about this, Wisconsin, where people want their jobs. And they instinctively know what's best for their families, and starvation and poverty is very painful, and that's what we see with businesses being threatened and so forth. I wish I had a timer here. Oh, there it is. Thanks. So again, I just want to thank you for being a listening group. I really appreciate that about you guys. I'm trying to do my part, and with the population, I have 8 children. So, and I think it would help if we made abortion illegal as well, then we could have more workforce. But thank you very much.
I believe it's Michelle Pennison.
Hi, this gets a little easier every time. Michelle Dennison, I live in Hudson. I did not grow up in America, but I have traveled to a few countries in the world. There is no place I would rather live than right here in St. Croix County, Wisconsin. However, I never imagined the infringement on civil liberties and that constitutional rights could become irrelevant. We are facing a communicable disease ordinance that would do just that. Since hospitalizations and death couldn't possibly justify this ordinance push, I assume we are looking at the current cases in the county. The rapid antigen tests used have been proven to have a high false positive rate. The PCR test is also being used. However, even the CDC suggests that it is extremely difficult to detect any live virus in a threshold above 33 cycles. The number of amplification cycles needed to find the virus, called the cycle threshold, is never included in the results sent to the doctor, merely that a test is positive or negative. With the CT information, we would know how infectious the patient is. The scientist who invented the PCR test, Carrie Mullis, specified that this test was not to be used as a diagnostic tool to test viruses. 90% of people who are testing positive carry barely any virus. Dr. Didier Raoult was the world's leading disease specialist until March 12th, when he advocated the use of HCQ. In April of 2020, he and other physicians published a report saying that the PCR test we are using is too sensitive. Other epidemiologists are saying the same thing. The PCR test amplifies genetic matter from the virus in cycles. The fewer cycles required, the greater amount of virus or viral load in the sample. Labs usually do not have access to the precise CT number. Most set a limit at 37 to 40 cycles, which is too high. Anyway, some Wisconsin labs are using as high as 45 cycles. In closing, I request please officially and publicly withdraw this ordinance. This is a permanent infringement on our rights. Thank you.
Good evening. My name is Jennifer Norden. I live at 1008 8th Street here in Hudson. I am opposed to the public health ordinance, but I have something I'd like to read. It's from the Star Tribune in Wyoming, actually, in regard to how seniors feel about death by COVID versus death by loneliness. And as we're thinking about public health and we're thinking about contagious disease and making these rules, I just want to remind all of you that it's important to consider all the deaths involved, all of the people involved. The the consequences of the actions of locking people down isn't just about safety. We're talking about life and health and not just about keeping people alive. This is written by the residents of Garden Square Assisted Living, and they say, "We, the residents at Garden Square Assisted Living, are writing to ask you to please consider opening the assisted living and nursing homes. We understand your desire to protect those of us with significant comorbidities, and we are grateful for the measures put in place to prolong our lives. However, we are suffering. Since the start of our lockdown, we have, as well as our peers, seen a significant decline in our will to live. The depression we suffer from not being able to see our loved ones face to face, hug them, hold our precious grandbabies is taking its toll on us. Our anxiety grows daily as the threat of death continues to creep up, wondering if we will feel our family's embrace before death. We were raised to respect our elders and to let their wisdom guide us. We raised our children to conduct their lives in this manner as well. However, our wishes, our freedom, and our quality of life is disrespected daily by this lockdown. We were never asked how we felt about it or which we would prefer. Many of us have gotten together and we all agree that we would rather risk death by COVID than death by loneliness." Thank you.
Hi, my name is Cindy Stockvis from the town of Hudson, and I'm one of those remote working immigrants from the state of Wisconsin. Why? Because of freedom, high taxes, and draconian controls like you see right now in Minnesota. I'm urging you to vote no for the public health ordinance as it stands for St. Croix County. Mass health dictates without proper consent, collecting data, execution of arbitrary mandates with open-ended consequences by unelected officials to dictate unreasonable and unlawful mandates on our residents is unconstitutional, and we say no. Facts on COVID from the CDC, 9,000 people plus died solely of COVID. All the others comprising the 220 deaths, 220,000 deaths, an average of 2.6 comorbidities. COVID SARS has an overall 99.7 recovery rate in the US, but our Wisconsin numbers are not representing the real data accurately. To perpetuate fear so that governor can do new mandates as issued today at noon. Dr. Scott Jensen, Chanhassen, who's also a Minnesota state representative in the area I used to live, went and explained on TV how physicians and hospital administrators were urged to put COVID along with real factors on death certificates for monetary reimbursements as well as hospital and ICU admissions. Significant monies were paid for COVID patients. This has been widely reported. Testing positive, and someone covered this, a positive test does not equate to having COVID SARS-19. Yet in Wisconsin, all the numbers are cases that we residents commonly see as data to make us fear, to make us lock down and to wear masks. Yet a high number of these tests are false positives. And here in St. Croix, the data speaks for itself. From February 1 to October 1, 970 cases that were positive, 9 deaths. Contrast that to Dane County, 10,201 confirmed cases and 43 deaths. Milwaukee County, 29,478 with 538 deaths. So I urge you to vote no on this. We don't need it. Just advise us that there's a problem, and we'll make a decision. Thank you.
Hi, Jen Flanders, Wilson, Wisconsin. If you pass this ordinance, you are violating the First and Fourth Amendment. If you pass this ordinance, you are violating the Nuremberg Charter of 1945. If you pass this ordinance, you are guilty of or in violation of 42 U.S. Code 1986, action for neglect to prevent, 18 U.S. Code 1035, false statements relating to healthcare matters, 18 U.S. Code 1040, fraud in connection with major disaster or emergency benefits, 18 U.S. Code 1038, false information and hoaxes, 18 U.S. Code 1341, frauds and swindles, 18 U.S. Code 241, conspiracy against rights, 18 U.S. Code 242, deprivation of rights under color of law, 18 U.S. Code 1342, fictitious name or address, 842 U.S. Code 1983, civil actions for deprivation of rights, 18 U.S. Code 245, federally protected activities, 18 U.S. Code 1962, Prohibited activities, 18 U.S. Code 1031, major fraud against the United States. You are participating in crimes against humanity. Notice to businesses and to the board. You are under no lawful authority to require employees or patrons to wear a mask. There is no statutory law that requires you, employees or patrons, to wear a mask. These are guidelines of the State Department of Health and local health boards. Any other order is unlawful and must be challenged. Preventing entry to your establishment of someone not wearing a mask violates these laws. Wisconsin Constitution, U.S. Constitution, federal civil rights law, Wisconsin civil rights law. If you refuse entry to any establishment which is open to the public, you are also restricting the free movement of an individual and engaging in false imprisonment. You are in violation of several laws if you prohibit the entry of someone if they are not wearing a mask. Furthermore, it's unlawful to enforce 6 feet separation as it restricts the movements of individuals and may be construed as false imprisonment. Declaring this as your store policy does not absolve you from your violation of the law. There's no regulation on the books that requires you to operate your business outside with plexiglass dividers or with restricting the number of patrons. Please completely and publicly withdraw this ordinance tonight. Thank you.
Gosh, I'm starting to feel like you're all family. My name is Jessica. I live in Hammond, Wisconsin. And today I just wrote something down I want to share with you guys. Can you imagine a life where you can only talk to people you love through a glass wall on a telephone? You get one 30-minute supervised in-person meeting per week, but only one individual if it's not from the same household. They must be 18 years of age or older, and they have to be at least 6 feet apart sitting at a table. There's no touching, absolutely no touching. And at one point, maybe you were in solitary confinement for many days in a row. And what if this was your life for 7 months now? This isn't prison. This is actually the life in a long-term care facility. This is the life that my grandpa lives every single day at a local long-term care facility right here in Hudson, Christian Community Homes. This is my grandpa. He's holding a sign that says, "I love you and I miss you." That's how I see him now. The public health officials make these requirements. They come right down from the DHS and right to your home. I've heard many people skeptical of the draconian measures we have been speaking about. People say they wouldn't actually remove people from homes. They won't actually isolate individuals. But guess what, guys? They already are. It's already here. 134,000 elderly have died from dementia since March. My grandpa has dementia. He's 92 years old. He has no voice. I am his voice tonight. He lives here in Hudson. His life is gone. He fought for our country. He fought for the freedoms we're sitting here debating on tonight. Unreal. This is the real epidemic. 13,200 more elderly with dementia died since March than they did in that time frame last year. I'm asking you to remove the communicable disease ordinance from any further agendas.
Hi, my name is Ron Stae. I live at 105 French Court, Roberts, Wisconsin, and I am 100% against this ordinance. But I am here today speaking on behalf of the Baldwin-Woodville Amish community, which they live at 2205 80th Avenue, Baldwin. This is regards to our lords of the land that we pray and ask you not to take our freedom from us. We as a group of 48 families are very much opposed to your new regulations, and that concerns of having the health department more power in all the other items in your plan. We have had a few hundred years of freedom, and we want to be thankful for having it. Now these new regulations wouldn't fit into our Constitution for having those rights taken away. Hoping you would reconsider your plans, we want to obey the laws of the land as long as they are constitutional and not against our beliefs. We hope something can be worked out for all our good. Let us ask God for guidance. The United States is based on freedom of religion. Bishop Amos Miller. Thank you.
Dr. Jeremy Bischoff, I reside here in Hudson. I own and operate a health clinic over in Woodbury, Minnesota. I'll start with a quote from Abraham Lincoln. "No man is good enough to govern another man without the other's consent." I want you to consider those words, and in that heart, table this health ordinance and the appointment of this health official. When we look at the Midwest, and not just cases of COVID, but actual deaths, the obvious leader in the lowest death total is South Dakota, who's had the least amount of mandates on people's freedoms. My question that I'll leave you with in very short form is, why are we modeling recommendations or talking about modeling recommendations after cities and states that have actually had more restrictions but higher death tolls? Why aren't we modeling them after the most successful ones? Thanks.
Darla Myers, 1098 Golden Oaks Lane. I am here as a private citizen and not a Town of St. Joseph supervisor. I am just going to go through some unscientific and results from the survey that the county put out. So this afternoon I sat down and made a list of those that left comments that were for no, and those that left comments that were obviously yes, and then some that didn't apply. Out of those results, 455 people responded no. 75 were yes. 31 were unknown. I don't know how much the taxpayer had to pay for that survey, but if it was so important that they wanted a survey, I think we need to look at those results, and please read those comments. There were several comments about the biased nature of the survey, and there was not a question as to whether or not you would want the survey, even if the ordinance, even if it were in draft form. So please take a look at what the taxpayer had to pay for, what the county wanted to show and put forth as their best foot, which I have a question as to whether that was. So again, 455 were against. Thank you.
You ready for me? Okay. Hi, I'm Shelly Vancil. I live at 1024 6th Street in Hudson. I'm here to oppose the communicable disease ordinance. Just want to talk a little bit about CDC numbers. They just released on September 27th the new estimate of the infection fatality ratio by age. So 0 to 19 years is 0.00003. 20 to 49 years is 0.0002, 50 to 69 years is 0.005, 70 plus is 0.054. And on the 25th, the CDC released the latest COVID survival rate numbers. It's 0 to 19 age is 99.97, 20 to 49 years is 99.98, 50 to 69 is 99.5, and 70 plus is 94.6. These numbers are telling us that we do not need stricter rules and punishments, and that we should not be shutting down the economy, closing schools, and not leaving our homes and living in constant fear of a virus that has a 99% survival rate. This is what we have to keep in mind now. Not how many cases we have, because we have millions of cases of influenza each year. And while, yes, coronavirus isn't the flu, it isn't the Spanish flu, it isn't SARS, it isn't MERS, the recovery rates should be the only thing that matters right now. By now, I know a handful of people who've had COVID. All of them were sick for a few days. They got better with rest and zinc, and they're perfectly fine. This is a lot of concern right now for our country with, or our county with the rapid increase in positive cases, which I get is alarming, but we need to
I'm
focus.
going through Janet's stuff room.
Sorry, what? Can I keep going? Okay. So we have a lot of positive cases right now, which I get is alarming. The reason that there are more cases within the last couple weeks is because we are testing more, a lot more. We should not be giving new powers to an unelected official to make draconian decisions for everyone based on the fear of a virus that has 99% survival rate. It's not the government's job to protect my health. It's the government's job to protect my rights.
Time is up. Close it up, please.
My job to protect my health. When you trade liberty for safety, you end up losing both. Thank you for your time.
Hi, my name is Sherry Lewis, and I live at 1800 Gray Fox Lane. I am married to a soldier. I have 3 boys. They are all soldiers. They fight for this country, and I have seen a lot over the years. It breaks my heart to be standing here, seeing this even going on. 6 years ago, because we are military, we have moved around a lot. 6 years ago, we came home for Christmas. At 12 below zero, we said, we miss this place. We want to come back. So we worked hard to make his next move to be able to come back here. So we came back here 4.5 years ago, and I love this place. And I love the people here, and I love the environment and everything about this place. But to see what's happening, and as Dr. Jeremy Bashaw said, when we look at what is going on in South Dakota and their low statistics, and we look at how they haven't stopped anything, I too wonder why we are not following that model. There have been so many things that have changed as far as in just what we see when we look at what's going on in places where there are people together. The amount of people who get sick, the amount of people who recover, we all probably know somebody who has been sick and has had very little symptoms, and people who have had more difficult symptoms, when they treat it right from the beginning, get the right care, they're fine. We look at what's going on, like when we compare flu viruses to other years and stuff. This really is not any different. Just like we see people getting sick with other things, we care about them, we want to see them get better, we want to see them recover. But we have never done anything like this before, and it's setting a precedence that really is inappropriate for all the other things that we've heard from all the other speakers. Thank you.
Hello, my name is Michelle Horsley. I reside in Hudson at 1701 Pheasant Run. I also run a business out of my home in the Hudson area. I oppose the current proposed communicable disease ordinance. This ordinance is full of vague language, undefined language, which further is dangerous language. It appears the authors of this draft have completely overlooked or forgotten that people have common sense and intelligence. People know best how to take care of their elderly family members and their dependent children. This ordinance is full of medical advice and medical requirements. For example, isolation, with no safeguards for a person's entire health, physical, and mental state, or who can provide them the best care. Throughout the health committee meetings I have been attending, I have seen arbitrary numbers with no basis in comparisons to other health issues. These arbitrary numbers are presented as levels of concern to our health board. So I just request that as leaders for our community, you should use caution so as not to proceed based on arbitrary feelings. Thank you.
Hi everyone, Lynn Betzold, 706 159th Street in Roberts, Wisconsin. And I'm going to appeal to the highest law that I know, and it's higher than the Constitution. And it comes from this book that is not illegal yet, but it is the most despised book on the earth and has been tried to be squashed. Something I've been doing lately is just randomly opening the Bible to see what is there. And I have something to share with you tonight because I feel as though some of the leaders are not listening. They've made up their mind. And I appeal to this higher moral code. And the Lord has sent to you all his servants and prophets, rising early and sending them, but you have not listened, nor inclined your ear to hear. This is Jeremiah 25:4, verse 5. They said, repent now, every one of his evil way and his evil doings, and dwell in the land that the Lord has given to you and your fathers forever and ever. Do not go after other gods to serve them and worship them, and do not provoke me to anger with the works of your hands, and I will not harm you. Yet you have not listened to me, says the Lord, that you might provoke me to anger with the works of your hands to your own hurt. Therefore, thus says the Lord of hosts, because you have not heard my words, behold, I will send and take all the families of the north, says the Lord, and Nebuchadnezzar, the king of Babylon, my servant, and will bring them against this land, against its inhabitants, and against these nations all around, and will utterly destroy them, and will make them an astonishment, a hissing, a perpetual desolations. Moreover, I will take from them the voice of mirth and the voice of gladness, the voice of the bridegroom and the voice of the bride, the sound of the millstones and the light of the lamp. And for those of you who know Revelation, there's some symbolism there. I pray that your eyes will be opened to the truth and that you'll be given courage to do the right and moral thing, our highest law in the land. Thank you.
My name is John Ritchie. I was born in Hudson Memorial Hospital, and I have lived for the past 30 years in Star Prairie, 211 First Street with my wife, where we raised 3 boys. When I was a boy, our mothers invited other children over when we had chickenpox. They knew if children got chickenpox when young, the disease was most likely to be irritating but manageable and not deadly. It is when people are older that chickenpox is more likely to be dangerous. Sound familiar? There's wisdom in letting children play together without masks. That's science. Now, my 90-year-old mother is being cared for by my 71-year-old sister. They have decided to quarantine. It's based on information given them, and that is their choice. They have decided. Article 1, Section 1 of the Wisconsin Constitution states, all people are born equally free and independent and have certain inherent rights. Among these are life, liberty, and the pursuit of happiness. To secure these rights, governments are instituted, deriving their powers from the consent of the governed. This proposed St. Croix County Communicable Disease Ordinance denies us these rights and is obviously presented by people who do not respect our right to individual freedom. Section 41, lines 1 through 4 are purposely vague in defining the powers of the Department of Health Services, giving it great authority over any city, village, or town in the county, unless those municipalities have their own HHS department, and I suggest they create one at the soonest board meeting. The most used word here, I think, is words here necessary to control. What is reasonable? Issuance of local orders. They get to do, the Department of Health Services is allowed to do what they want. I believe this proposed ordinance is purposely tyrannical. It is a bargaining point to start harsh, to get something in the middle, the most one can. I suggest the bargaining should stop. The citizens should decide what the county health officer and services job is and what ordinances should be appropriate for the department. It is a conflict of interest for the health department to make their own job description and ordinances. Thank you.
Hi, Hillary Campbell. I live in River Falls. Can you hear me? I'm a critical care nurse. I've seen the destruction this virus causes on individuals. I understand the need for policy and procedure to prevent the spread of disease. I don't believe that this ordinance is a way to instill confidence in our community. I fear the medical hesitancy that may come from an ordinance like this, where individuals are scared that family will be removed from their home. I believe we can do better to protect our freedoms and provide safety in our community. Thank you for your time and all that you do.
My name is Rachel McCardle. I live on 420 Orange Street here in Hudson, Wisconsin. I'm here today to express my opposition to the Communicable Diseases Ordinance. Almost a year ago today, I gave my very first public comment before the St. Croix County Health and Human Services Board to express the importance of medical freedom, to urge that individuals maintain body autonomy and control over their health care, and that those rights extend to their children. Because my healthcare choices should be my choices, not the choices of my elected officials or unelected officials. At that time, my concerns were directly related to our children, but I told the board that soon it wouldn't just be about the kids. Eventually, your rights and all of our rights would be on the line. Look at where we are now. Last year, the Health and Human Services Board heard our opposition and chose not to act. Myself and many others continued to monitor St. Croix County. We also have spent countless hours traveling to Madison to lobby for health freedom, and we have had many successes, and our numbers are only growing. I urge St. Croix County again to hear our opposition and to take no action other than to withdraw this ordinance. We will continue to watch, we will continue to show up, and we will continue to fight for our freedoms at the local, state, and at the federal level. Because our rights and our freedoms, they are worth it. My children's future is worth it. What is your health freedom worth? Will you blindly hand it over, or will you stand with us? Thank you.
Raise this up a little. I'm Jennifer Krohn-Shoup, live at 634 91st Street, Hudson, Wisconsin. I oppose the communicable disease ordinance. I am pro-freedom. I'm pro-critical thinking. I'm pro-conversation, pro-every voice matters, as I'm sure and I hope you all are too, sitting here tonight. I have to step back and look at critical thinking. According to the CDC's website, 414 0 to 24-year-olds in the entire United States have passed away with COVID, not due to, but with COVID. As a healthcare worker, suicides, domestic abuse, and other cases far surpass this across the country. I hear from the children in our community that they are struggling with mental health, anxiety, sensory, domestic abuse issues. The police in our community have been inundated with this just due to the stress of this epidemic. Allowing this ordinance extends this and just continues to strip away our freedoms. We were told masks for 1 month to slow the spread. Numbers have increased and the mask requirements have extended. When does this stop? My children's school just closed down 1 day a week, no education. The teachers are required to be there, but the kids will not be educated, and the parents have to figure out what to do with their kids on that day. Not due to COVID cases, mind you, but due to the mental stress placed on the teachers from this. This ordinance is a complete overstep of our rights as citizens, and let me just read this from our forefathers, the last paragraph of the Gettysburg Address. It is rather for us to be here dedicated to the great task remaining before us, that from these honored dead we take increased devotion, that we here highly resolve that these dead shall not have died in vain, that this nation under God shall have a new birth of freedom, and that the government of the people by the people, and for the people shall not perish from the earth. I oppose this ordinance. Please remove it. Thank you.
Hello, my name is Mark Carlson. I live at 316 170th Street over in Pleasant Valley. And I'm here, and I'm actually kind of surprised at how angry I am because of these ordinances and mandates that infringe on people's rights. I'm retired now, but I'm just a simple Uber driver, and I was driving people around after the lockdown, and it was so sad because I was taking one person home after another that was crying because they just lost their job. But everybody said, oh, it would just be 2 weeks. In 2 weeks to flatten the curve, and then we can all get back to work. And the reason to flatten the curve is the CDC said that we're all going to get this eventually. If you would have put a mask on the day the lockdowns happened, if you walk out the doors, it's still there. And maybe a vaccine, we'll get a vaccine eventually, maybe not. But to hurt people by shutting down businesses, Evers just put restaurants back to 25%. More are going to go out of business. More people are going to be out of jobs. The effect that these mandates have are just horrible on people. They're unconstitutional and they're wrong and they should not be happening, especially to go ahead and do this vague ordinance that gives somebody that we didn't elect in Health and Human Services forever, at any time there's a virus, they can do any lockdowns, just totally, again, take away our rights. So because we have these rights, I am so against this ordinance, and I ask that you vote to not even consider an ordinance like this. Tell us what we need to do, don't tell us what to do. Is the best way to go, because we all need the advice, but we're smart people with individual rights, and we will do what's right to protect ourselves. We don't need mandates. Thank you.
Hi, my name is Sarah Backlund. My address is 573 Omaha Road. I stand before you today in opposition to the communicable disease ordinance. Have you heard the term case-demic? That is what we are in. We are in a case-demic. We are testing nonstop. Why are we doing this? What is the goal of this besides just getting our numbers up there so that we have cause for a state of emergency? Have you asked yourself that? Referring to the public health officers, Dr. McGinnis had said, they are stretched thin, exhausted, and discouraged. Exhausted of what? Calling people nonstop, babysitting them? He certainly wasn't referring to our hospitals. They're not overrun. The cases are rising here, but there is still an over 99% survival rate out of these cases. We have two hospitalizations and 8 deaths. These numbers have been basically stagnant for months now. The COVID epidemic is over. I can, however, think of other epidemics. Government overreach, over-testing, our elderly dying of broken hearts and loneliness in the nursing care facilities, the current suicide rate, the economy, the schools with their unsustainable plans, the exhausted teachers, our kids who are afraid to do anything and are afraid of each other, and on and on and on. It's time to refocus. It's time to get back to life. The side effects of what we are doing has far outweighed the risk of COVID. This needs to stop, and I ask that someone here tonight makes a motion tonight, again, to withdraw this ordinance completely. Thank you.
My name is Mike Stoddard. I live at 1219 Briarwood in Roberts, Wisconsin, and I'm here tonight as a private citizen, as not as part of the National Guard. I've been home for 60 days from Afghanistan. I've been isolated for 14 days by myself in a room, smaller than the size of that podium you sit at. It's miserable. I didn't have a choice. It was a direct order that I followed. And you're going to involuntarily tell somebody that a single individual, the St. Croix County Health Officer, may require isolation or quarantine of a subject. Where are they going to go? Who's going to take care of them? Who's going to provide them food, water, heating, cooling? Who's going to make sure they have somebody to talk to? Who's going to make sure that there is somebody there providing an interaction for them? Human contact is the greatest thing for a human being. We don't shake hands because it's polite. We shake hands because we desire a touch. It releases serotonin in our brain, creates that human connection, that bond. These are all things that I learned in the 14 days I was quarantined. Those are things that we need as human beings. This states that one individual will be able to take that away from me if they deem that I have COVID or some communicable disease. I spent 9 months away from my wife, my children, my friends, my extended family. I had more freedoms locked down in Jalalabad than I will have underneath this rule. I oppose it, and I hope that somebody takes it off. There was a lady up here that said her family moved back here, and they fought to be assigned back in Wisconsin as part of that military family. We've earned the right to make our own decisions. We're adults. This is what we do. We make our own decisions. Our forefathers fought for individual freedoms. Please give us our individual freedoms and do not take them away. Thank you for your time.
Hello, my name is Scott Campbell. I live on Troy Glen Drive in River Falls, and I just want to thank every one of you for being here tonight and listening. I oppose this ordinance as an American citizen who is sick and tired of my rights and freedoms being chipped away constantly. I know as an American we fight for every freedom, my problem with this ordinance is the wording. First and foremost, any disease, they can classify any disease. The next, I would have to say that the outbreak, what determines an outbreak? Is that 1, 100, 1,000? Unelected. Who unelected do we give this much power to? All measures to enforce. I'm a worker, always have been. Take after my father. He showed me some very good values in life, and I have a problem with the required isolation and quarantine. The problem I have with that is who's paying for the quarantine when the families are away from work, who's paying for the child care, that's a huge problem that speaks high volumes, and especially people that are living paycheck to paycheck, because I think the handout that we get now is coming to an end, and we're going to have to figure out some means of payment for people that aren't going to be working under quarantine. And I'd like to say the one thing that first, powers, the health official shall have all necessary powers to enforce the provision of the ordinance without limitations. That speaks volumes. Thank you for your time.
Good evening. My name is Stacy Kupka. I'm a resident here in Hudson at 961 Daly Road. Thank you for your time, and thank you for listening to all our public comment. It's appreciated. I just want to talk a little bit about the ordinance, and my opposition towards the ordinance. I've been attending the HHS meetings, or the committee meetings, and the subcommittee meetings, and there's just a lot of concern, especially to the wording and the very vague wording of the ordinance. When this has been brought up, I've emailed many of you. I've emailed many of the HHS committee members. Some of you have responded, and thank you for that. Often there haven't been answers to the questions. It's just a response of thank you for your comment, or thank you for your, expressing your concern. However, there have been a few comments that, the ordinance would never remove somebody from a home, or it's not for this extreme purpose. My question would be, why is it worded so vaguely then? Why is that not put into the wording of the ordinance? If it's not meant to do those certain things, why can't it be worded so that that potential would not be there? Also, I wonder why HHS has picked out of the three options, they picked the one with the least amount of oversight and accountability, and that's a concern to us. There were three options, and we wish, that the one with the greater oversight would have been, and the greater accountability would have been maybe considered more. And then finally, just want to, in light of everything going on in our state with Governor Evers, and again, how he's been illegally doing things, our faith in our government has plummeted. Our faith in our elected officials has plummeted. In this oversight, or this ordinance definitely opens the door to government overreach, and our faith in you, in the ability to not overreach, is very limited right now. So anyway, thank you for hearing me out. Have a great night.
Okay, we have no more slips, and I'd like to thank all the public for their comments. Thank you for taking your time. We appreciate it. At this time, I'm going to close the public comments, and does anybody need maybe a very short break here? Let's take 5 minutes, and then we'll start on with the business items. At this time, I'm going to possibly reconsider opening just briefly. Apparently, there are 4 people that feel that they were somehow passed over inadvertently. So unless any supervisor has an objection to an additional 8 minutes, I believe it would be 4 of them, I'll go ahead and open it. Any objection from the supervisors? Okay, let's proceed. You've got 2 minutes apiece.
Is that on? Okay. You need to know my name and where I live. It's Shannon Merrick, and I live at 397 Cedar Court in Hudson. I'm here to tell you that I stand in opposition of the health officer ordinance. This is an ordinance that gives unlimited power under the law to an unelected official during a time when the science and the statistics are both inconsistent and in constant evolution. This is a huge overreach of power, using broad and sweeping terms such as certain authority, which is both open to interpretation and highly subjective. Any communicable disease, where does that end and where does that start? We've never done this with previous viruses. It's a little suspect that we're doing it right now with a virus that has a above 99% survival rate. In here it says grounded by science, and there's a huge concern about where the science is coming from, the motives behind said science. How do we allow a single unelected official to determine the fate of our community? Under what conditions do they get to determine what is necessary? This is the most concerning part for me, that the health officer shall have all powers necessary to enforce the provisions of an ordinance without limitations. I'm pleading with you all just to reconsider the words that are being used in this. This is very concerning as a citizen. I'm a mom of 2 kids. We are doing everything we can to be safe, but to broad sweep it under these terms is, it's scary. There we go.
My name is Rico Heisler. I'm a 16-year resident of Hudson, and I live at 1404 2nd Street. The overwhelming majority of those who have been harmed and who continue to be harmed by this pandemic have not been hurt by COVID itself, but by the mandated and imposed upon responses to COVID by our community leaders, elected officials, and bureaucrats. One of our presidential candidates is running a campaign ad which says safety is #1 priority. Well, safety is not our #1 priority. As Americans, liberty has always been our highest priority. The liberties we enjoy in our nation and cities and towns would not exist if those who came before us, who established and enshrined our liberties, valued safety as their top priority. If we are willing to discuss enforcement measures that include the potential suspension of constitutional liberties over a disease that so far has only contributed to the death of 8 out of 90,000 St. Croix County residents over the last 9 months, then nearly anything can be justified as a health emergency. The anthem of our day is the science says, but science is not alive, it does not think or communicate. Science does not tell us anything, but rather it is people who employ scientific methods and principles to make human judgments and determinations. Science has become a tool of politics, and just invoking the word science is used constantly to silence dissenting voices. We're told that there's no debate in the medical community, but science doesn't exist without debate. If it did, the earth would still be flat. But without debate, there is no science, only the tyranny of experts. We're told that cases in the county are rising and that we are doing a lousy job of managing this pandemic. But how is it lousy when only a few St. Croix residents are being hospitalized and even fewer have died? These numbers, not the case numbers, strongly indicate that voluntarily we are doing an excellent job of protecting the medically vulnerable. But we are doing a lousy job of protecting our students who are being limited by in-face education. We're doing a lousy job of protecting our business owners from doing business as they see fit. Enforcement may be intended to prevent the spread of infection and diseases of loss of life, but who or what protects citizens from loss of liberty? It is the government's job to ensure our liberties will not be denied by force. Government is not to be the force that denies our liberty. Thank you.
Hello, my name's Troy Killer. I live at 80 Heritage Boulevard in Hudson here. First off, I want to say I'm 100% against this ordinance. We're slowly losing our rights. And during this whole pandemic, my grandma passed away back in April. We've been unable to have a funeral for her. She had an accident. She went into the hospital. Nobody was able to visit her. She died alone. And that's pretty sad. She was buried in Fort Snelling by herself because we were lost our rights to gather for a funeral. This ordinance is going to make that happen to more people. I am sick and tired of ordinances like this taking away our rights. And I beg and plead with you that you vote against this and do not pass this ordinance. Table it and get rid of it because it's a joke. Thank you.
Thank you, Board. My name is Jim. Live in 1771 Hammond, 96th Avenue. Sorry. Thank you for your time. It's a lot of time that you guys have spent dealing with these situations and the people coming in and talking. Please listen to your community, the people that are in front of you talking. I'm against this ordinance. It's hindering on so many families, friends, school children in the schools. They need to have just social gatherings to be able to be with their friends. In some situations, school is a safe place for these kids. And if you're taking those situations away, it's only knows what could possibly happen. So thank you very much.
Okay, I'm advised that that is it. Is there anybody who has not had a chance to speak, who would have anything new to fill us in on? If not, I'm going to close the public hearing at this time, or public comment. Okay, I'm going to close public comment at this time. And the next item would be the consent agenda. And, well, let's see, we need a motion to bring that to the floor, I believe. So a motion from Supervisor Osnes, a second from Supervisor Ard. Any discussion? I'm not seeing the screen, so if somebody needs to speak up if you have any objection. Seeing none, I guess we're ready to vote at this time. So all those in favor signify by saying aye. Aye.
Aye.
And opposed? Carries unanimous. Thank you. Next item would be the financial report and the administrator's report. Ken?
Thank you, Chair Peterson. When you look at the financial report, we're 2/3 of the way through the year, so you should see 33% of the budget remaining. On our screen, we have it mostly blocked off with the faces from the Skype participant or Zoom participants, but I can assure you that that's where most of the revenues are falling. They're falling right in line. When we get to the expense side, the expenses, you're going to see greater than 33%, and that means that's a good thing because that means we spent less of the budget. One of the things I did want to point out, though, when we look at total expenses for the year compared to where we were last year, we're running about $600,000 ahead of where we were. And when we look at public health, we're running about $200,000 ahead in public health. So, that's a large number out of the total. So to give some explanation to that is related to the amount of cases that we have. So if you look at, let me get the right one here. If you look at the number of cases that we've had in St. Croix County, you'll see that it's increased significantly over the month of September. So that's what's driving the cases. So every time there's a case, there's a follow-up where they do the contact tracing. So we are adding staff really as fast as we can hire them and train them and retain them in order to do that contact tracing. That contact tracing, though, is very, very time-consuming, and there's really at some point where we have a hard time really even accomplishing all of the tasks that are related to that without ramping up even more staffing. So it's a balancing act, and I think Kelly and the HHS director, Bob Rohrt, are doing a good job of managing that the best they can. I know a lot of my peers across the state have been complaining about the same issue, so it's not localized just to St. Croix County. But when you do see expenses for public health well in excess of where we were last year, when really the department's the same size other than the FTEs, this is the reason why. So I did want to just point that out. Maybe that's overly obvious, but as part of the report, it's one of the things I wanted to mention. Other than that, the rest of the financial report is right on track. Sales tax continues to be strong for St. Croix County, as we heard from Dale Knapp from WCA earlier. And we're going to finish ahead of projections, I'm sure, for the year on sales tax for the year. Are there any other questions on the financial report?
Supervisor Achterhoff.
Okay, I just have one on page 27, number 610, the Kitty Roads Dementia Unit for revenues. It's like way, 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 way down. I mean, we anticipated over $1 million, and the year to date is 82,000. What's going on there? Because I thought everything opened up.
Well, everything opened up, and then we hit a pandemic, and nobody really wanted to move then in the middle of that. That's the main problem that we're seeing. So we did receive our Medicaid waiver in March, I think it was, which was right around the same time that the pandemic hit. So we weren't able to fill the facility before that, and people have been reluctant to move into the healthcare campus facility in the middle of a pandemic when we have a lot of additional restrictions on that building. So it's going to take time before we hit those revenue projections. Those revenues that are projected are based upon a much higher occupancy rate than we currently have.
Further questions? Seeing none, thank you, Ken.
Thank you.
Next item then would be the consideration of the ordinance amending comprehensive zoning, map chapter 15, extensive reading there. Let's see, we need a motion to bring that forward. I'll look for a motion. Supervisor Hanson makes a motion. Do we have a second? Supervisor Osnes, the second. Open for discussion, and do you want to cover it? Supervisor Hanson, go ahead.
You bet. What this is making not really adjustments, but it's small parcels that needed to be changed to be in line with the zoning ordinances as we come into line with our Chapter 15 ordinance, as we changed from what used to be called Chapter 17 now into Chapter 15. We're ending the year period of time from adopting Chapter 15, and these are different parcels that needed to be rezoned to come into compliance with each different town's use plan. And so we're just, it's kind of tidying things up.
Questions? Comments? Seeing none, I guess we're ready to vote at this time then. All those in favor?
Mr. Chairman, a roll call vote is required.
That's correct, yes, I guess that's correct. What, Cindy?
I believe that it is.
Ed Schockner?
Yes.
Sean Anderson?
Yes.
Bob Long?
Yes.
Kathy Leaf?
Yes.
Kara Cook?
Yes.
Tim Hall?
Yes.
Paul Burning?
Yes.
Rick Otino?
Yes.
Bob Fiedler?
Yes.
Dave Osnes? Yes. Scott Coner?
Yes.
Dan Hansen?
Yes.
Scotty Yard?
Yes.
Greg Telejohn?
Yes.
David Peterson?
Yes.
Paulette Anderson?
Yes.
Judy Achterhoff?
Yes.
Shelley Tomschick?
Yes.
Bill Peavy? Bill? Say yes.
Unmute.
Nod your head.
Thumbs up or down, Bill?
Yes, thank you. Yes, from Bill Peavy. It's unanimous.
Okay, it carries unanimously, thank you. Next item would be the resolution retaining ownership of Apple Valley property, and Supervisor Hanson moves to bring that to the floor. Supervisor Long seconds, and discussion.
Yeah.
Supervisor Hanson.
This is a small property that came back to the county because of taxes. And just after the county acquired the property, there was a fire and the house burned down. The house it's a largely unbuildable lot. There's a footprint of a little tiny house, but it's the kind of property where if we sold it back into the marketplace, it would be so restricted because of the setbacks that it could almost not build a house there. So therefore, it made sense to ask the administration to committee to consider just retaining this property so that we could put a little public use, like a little fishing area there, and turn it over to the Community Development Department to come up with some use, and not take a chance of selling it to somebody who then would turn around and cause problems like we had with the most recent lawsuit of somebody who thought that they had a right to build there and didn't. So we thought we'd just keep it, and that's what this is. How'd I do, Bob? That make you understand? Yeah, there you go.
Further questions, comments? Seeing none, I guess we're ready to vote on this, and seeing there's no money involved, we can do a voice vote. All those in favor signify by saying aye. Aye.
Aye.
And opposed? Motion carries unanimously. Thank you. Next item, resolution, charge back illegal real estate taxes. And Supervisor Long makes the motion to bring that forward. And Supervisor Osnes, the second. Discussion. Ken, you want to cover that briefly?
Yeah, actually, Corporation Counsel loves covering this one if he wants to take the illegal taxes.
Ken, I think you're exaggerating once again. So this is an annual thing that all counties do. Inevitably, there are mistakes in the assessment of taxes, double taxation, so forth. So there's a provision in the statute which allows the treasurer to apply for, or basically request the county board to declare certain taxes illegal, and then they're just charged back to the municipalities. Something that we do every year.
Any questions, comments? Guess we're ready to vote, and does that require, shouldn't require
No.
Okay, so we're ready to vote. All those in favor signify by saying aye. Aye.
Aye.
And opposed? Carries unanimous. Thank you. Next item is resolution authorizing fund balance transfer, and that will Supervisor Long moves to bring it to the floor. Supervisor Burning seconds. Discussion.
Yeah, if I may, Mr.
Supervisor
Chairman.
Long, go ahead.
I'd like to just add a couple comments. I'm hoping that the description that was attached give everybody a little more background on this issue. First, I want to clarify one thing is that the administration committee didn't necessarily recommend approval of the resolution, but rather recommended moving this forward for the full board to discuss and consider. So basically, the idea here is we want to help people. We want to help some of our property owners, our taxpayers, and we say that, you know, we're all in this together. Well, this is an opportunity for us to practice what we preach and try to help our property owners through not having any dollar increases in their property taxes. For some people, it may be not that meaningful, but I think for a lot of situations, it could be very meaningful. There was just an article in the Wall Street Journal today talking about commercial property foreclosures and how that was increasing. And the expectation is that's going to spill over into restaurants. Imagine now that they're going to be down to 25% capacity, as well as hotels and apartment buildings. So I think there's a lot of other situations that not having a dollar increase in property taxes could be very meaningful and could really help people out next year. This would be their 2020 taxes payable in 2021. As far as the impact on the KIP, we're still showing a $1.1 million transfer to the KIP, and if you recall, the KIP that we approved last month illustrated a $1 million transfer. So we're being also consistent in what we're transferring into the KIP for future projects. Now, the negative or the downside that we need to consider is that this is a one-time thing. So people might be happy in 2021 paying their 2020 taxes because they wouldn't have a dollar increase, but that may also result in potentially larger increase in 2021 payable in 2022. So that's really the downside that we have to consider. But I think considering that this is, everybody has the expectation this wonderful COVID situation is going to make its way into 2021, I think this is something that's a good opportunity for us to try to help people out and maintain their property taxes. But I'm really interested in everyone's opinion.
Supervisor Hanson?
Thanks. That was real well said, Bob, and I appreciate your insight. But I have to respectfully disagree. I have come to understand the debt cycle pretty well in my 7 years on the county board. After the audit is finished, I've watched the administrator recommend that we return what's left over to the KIP. And we've done that each of the 7 years that I've been on the board, and it helps to alleviate the pressure on what might need to be borrowed in the next cycle of bonding. So what we're doing is paying to take care of those assets that we have right now and continue to expand the maintenance process, the preventative maintenance process that we have in place with those funds, and prevent or keep the debt service lower by that amount of money. So if we put the money directly into debt service, then we're probably going to need to take that much money out of the bonding the next time around. So what it comes down to me is that I feel a sense of trust in the administrator. We hire good administrators, and I feel that we need to trust the administrator who's a professional in this business in giving us the advice that we rely on them to give us. And in this case, I'm not qualified to make decisions with this number of dollars, and I've come to understand a layman's terms of the bond debt cycle and funding the capital improvement. And I think I'm going to vote for the administrator's recommendation, and I'd kind of hope everybody else considers that too. Thanks for listening.
Further comments? I heard somebody, I believe. Was there somebody on the board that wished to speak? Apparently not. Anybody else? Okay, I think for clarification then, if, as Supervisor Hanson says, we go with the administrators, then we would vote against this resolution. Would I be correct in stating that? If they want to go ahead with the resolution as stated, then they would vote a yes on it. Is that correct?
Yeah, the current resolution, the way it's drafted, is transferring $1.1 million to the KIP and $800,000 to the debt service fund. So you'd either vote against it or you'd amend this resolution, I would think, to Supervisor Hanson's point.
I got a question.
Go ahead, Supervisor Achterhoff.
So if we vote against it and no one's brought anything, an alternative forward, then what happens?
I believe it would be my understanding then we would go with the administrator's recommendation that the 800 million, or the 800 is it, would go into the KIP fund. Is that correct?
Yeah, I think the two alternatives that we discussed was, would you transfer the 1.9 million to the KIP, or would you transfer 1.1 million to the KIP and 800,000 to the debt service? I think those are the two options that we're talking about.
Well, that makes much more sense. That was well put. Thank you.
Mr. Chair, I'd offer an amendment that we take the entire amount here and put it in the KIP.
We have a motion for an amendment from Supervisor Hanson to take the entire amount and put it in the KIP. And is there a second to that? I see a second from
Supervisor Hall.
Supervisor Hall makes a second. Discussion. Supervisor Cook.
I'm wondering if Ken can speak a little bit about his recommendation and his concerns or not about the impact of the proposed 800,000 going to the proposed resolution before us.
It's a policy decision by the county board of how to allocate the money. If you're looking at it purely from a financial standpoint for St. Croix County, it is best to avoid future debt. And so to avoid future debt, you use your cash in the KIP to avoid that debt. That's what's best for St. Croix as the organization St. Croix County. So it's your jobs as the supervisors, though, to evaluate that with a lot of other factors related to taxpayers and the impact that transferring 800,000 to the debt service fund would have to reduce their tax burden. So it's a policy decision, and my recommendation is based on what's best for our organization.
Any other discussion or comments? Supervisor Achterhoff, I believe I see your hand up.
Out of total curiosity, would broadband ever fall under the KIP?
Yes, I could see a potential there.
Then I think it's vital that we add it to the KIP because, as we heard in this earlier speaker, St. Croix County's broadband is pretty horrific. And it's not going to be cheap to fix it, but it's going to be vital for the county's success to improve it.
I've been researching that, but I wanted to save that for like an interview question or something later, but.
Score one, Supervisor
That was
Osmus.
very well played. Nice job.
So again, what is the amendment?
So the amendment is to take the entire amount in the KIP, or put it all into the KIP. In other words, the 800,000 and the 1 point, whatever the tail number was there. So if we vote to yes on this, we're amending the resolution itself. Then we would have to go back and re-vote on the resolution itself. So, and I believe, does it have to be a roll call vote in the amendment to the resolution? Probably, huh? Well, Corp Counsel Cox, we need some.
I don't believe so.
Okay, so we'll go with a voice vote on the proposed amendment, and then we'll go with the roll call vote. So at this time, if there's no further questions, no comments, we will vote on the amendment to the resolution at this time. Everybody understands it, I believe?
How can you tell which of us on Zoom do yes or no if we're all talking at the same time?
It's a case of if you don't hear any nays, then otherwise they'd probably call for a show of hands on the,
Okay.
if that's satisfactory with you.
A thumbs up or a thumbs down would be
Thumbs down
helpful
also
also.
works, yes.
Yeah, the chair can ask for a division to count the votes if it's needed.
Okay, so at this time, then, we will vote on the amendment. So all those in favor of the amendment as presented by Supervisor Hanson signify by saying aye. Aye.
Aye.
Any opposed?
Aye.
Aye. Okay, let me see a show of hands of those. I see 1, 2, 3 opposed. I see 4 opposed. And 5 opposed. Okay. So 5 opposed, and the motion still passes then. Okay, now we are at the main resolution as amended, and that will have to be a roll call vote. Do we have further discussion on that? Seeing none at this time, then we will, I'm sorry. Okay, Ken, would you state the motion?
So the motion would be approval of the resolution transferring 1.9 million from the general fund unassigned fund balance to the KIP fund balance.
In addition to the 800,000.
1.9 would be the total then. Yep.
Point of inquiry.
Supervisor Burning.
I seconded the original motion, correct? And then my motion was amended. So now can I withdraw my second?
Supervisor Cox. I'm sorry, Corp Counsel Cox.
What would be the purpose in withdrawing the?
Yeah, you're right. Never mind.
I believe once it's on the floor, it belongs to the floor. Is that correct? Okay. So at this time, then, we will have a roll call vote on the amended resolution.
Ed Schockner.
Yes.
Sean Anderson.
Yeah.
Bob Long.
Yes.
Kathy Leaf.
Yes.
Kara Cook.
Yes.
Tim Hall.
Yes.
Paul Burning.
Yes.
Rick Otino.
No.
Bob Fiedler.
Yes.
Dave Osnes.
Yes.
Scott Counter.
Yes.
Dan Hansen.
Yes.
Scotty Yard.
Yes.
Greg Telejohn.
Yes.
David Peterson.
Yes.
Paulette Anderson.
Yes.
Judy Akhtaroff.
Yes.
Shelley Tomczyk.
Yes.
And Bill Peavy.
Yes.
18-1.
Okay, carries. The motion carries. Thank you. Next item, resolution amending the 2020 St. Croix County budget, and a motion for that to come to the floor from Supervisor Long, second by Supervisor Ard. In discussion, Bob, do you want to, or Ken?
You want to, I'll add some comments, but if you want to give a description, Ken, please.
Sure. The background on this is one of the ideas that was discussed at the Economic Relief and Recovery Task Force. They actually never made a formal motion on it. I sort of took it upon myself, timing-wise, to get it onto the county board agenda for them. The loan program that we had allocated $500,000 to for economic development, we'd issued $310,000 worth of loans. So we had $190,000 of that that's going to come back to the county. So this is transferring money out of that loan that's going to be unused because that loan program is closed now, transferring $50,000 to other purposes for economic development. This would be hiring a third-party consultant to create some target marketing material to assist the EDC and Bill Rubin in providing some leads, mostly out of Minneapolis. We're hoping that a lot of businesses would be looking to move out to the suburbs here and out of the Minnesota area. So that's what the budget amendment is for.
Supervisor Hanson?
Mr. Chair, I move to postpone indefinitely.
We have a motion to postpone indefinitely. Would there be a second to that?
Supervisor Hall seconds.
Supervisor Hall seconds. Discussion. Hanson?
In taking a look at this, I've become aware that the organization has reserves of $313,000. There's a lot of money there, and that since 2010, the county's contribution to St. Croix Economic Development Corporation, and bear in mind this is a nonprofit organization, it's not a function of the county. The county's contribution has been $1,099,963. There's been an awful lot of county money already flowing into the organization, and with $313,000 in reserve, I feel that the organization could probably afford $50,000 to hire a consultant if that's what they choose to do.
Further question? Supervisor Osnes.
Thank you, Mr. Chair. I'm wondering at this point in time, since the good supervisor has a large number of questions when it comes to the EDC, I would invite him to our next EDC meeting, and I think our economic development director could put him right at the front of our next agenda, and perhaps we could take care of a lot of the questions that he has.
I have a question. Supervisor Leaf. Hello?
I can hear you.
Okay, I don't think they can. Did we lose the boardroom? Okay. I was just going to ask a really good question.
I can hear you, Kathy.
Yeah, I know. We are on the Zoomer, so I think they just shorted out in the boardroom.
We're the baby Zoomers.
Yeah, I think all of the Zoom folks are kind of isolated here. I don't know how we flag.
We can hear you.
Oh, good. You heard our baby Zoomer Burke. Okay, a joke. Okay. Can you hear us so I can ask my question?
Yes.
Okay. So my question is, we had allocated the $500,000 for the loan program, and you had mentioned that $300,000 or $310,000 was used. I'm wondering if we'll get a report of how it was used, what types of businesses received it, and I'm just out of curiosity. And I'm also wondering if it's possible, instead of taking money for this effort, that we would instead extend that loan program, because we're coming into winter, especially for restaurants and smaller establishments that are going to have to get rid of their patios and all of these things. There could be a need going forward for that money. And honestly, the Fed Reserve today just said, if we don't control COVID, we're going to have economic disaster. So either that, or we figure out how to support public health more. But I honestly would rather extend this loan program and promote it a little bit more and have people have another opportunity to get that money.
Supervisor Hall, I would second Supervisor Leaf's comments on that. I would much prefer this money go to existing businesses that are already in the county that we can help, rather than try and bring someone else in. I think that was the original purpose of the money, and that's where I would like to see it to continue to go. We have a number of economic development organizations within the county. All of the cities have them with their chambers. I think this money, I would prefer to see it make a direct impact in the community by going to our businesses, by continuing the loan program.
Speaking to the loan program, this is the third loan program that were accessible to businesses in the state. There was a large size federal program that was almost indefinite in the number of funds they could draw from it. There was a large state loan program for businesses. And right now is the time when us as a suburb to the Twin Cities, people are looking for someplace more stable. Why would you not make them aware of what an amazing community we have here and entice them to move here and help with some of those working age statistics we heard are declining in this county?
In answer to that question, this is Supervisor Hall. I guess my feeling is that people in the Twin Cities are probably quite well aware of what we do and where we are, and that what really draws people to the community is the opportunity for a successful business to be here, and that we focus on providing those amenities, those services, and that sort of climate that they want to come to. I really have a visceral distaste for trying to steal businesses from other states.
I had another comment that I think one thing that makes us attractive is our strong main streets, our strong main street businesses, and that's what this program was intended to help. So I'm passionate about the small businesses because that helps local economies thrive, and then businesses realize that and come over. I have other questions about the consultant, but I'll save that for another time.
Supervisor Burning.
Thank you, Mr. Chair. So this issue came up as an idea in our subcommittee for economic recovery, and it was part of an intermediate play, not necessarily a short-term play, for our county, so that after COVID, which is now, after today, probably going to devastate much of our hospitality industry across the state if they comply. It will devastate them, and we will see a huge recession regarding hospitality and tourism, which is in the top 3 of Wisconsin's industries. So the reason that we looked at doing this is because of the instability in Minneapolis, and to the point that they know where we are, and they know who we are, and they know how great of an environment we have over here. I'll just say this, people know, like in business, when I'm out there talking to people, they know what my company is, they know what my company does, but until you do that touch, until you walk into that business and you say, hi, my name is Paul, I'd like to exchange commerce with you. Would you trust me to do that? I don't just have people ringing my phone off the hook, and I'm sure Bill Rubin doesn't just necessarily have his phone being rung off the hook because they know where Wisconsin is, and they know where St. Croix County is, or they know where Hudson is, or Roberts, or Hammond, or Somerset. That's not the case. And the point of this whole initiative, and originally the idea was to see if we could come up with some dollars to hire a full-time, almost quote-unquote salesperson to go out there and try to attract the businesses that have verbally expressed their disdain for what has happened over in the Twin Cities metropolitan area and the lack of law and order and the safety of their employees and their companies. And with that being said, I looked at that as an opportunity for us to let them know that they're welcome here in Wisconsin to move here, to build a nice building here, because we have some industrial parks with empty lots, and really make that direct touch and use not a consultant. I think that might be misworded. This is a marketing firm that's going to touch businesses, targeted businesses. And Bill, you can correct me if I'm wrong, but I believe that's what we went after, right? Okay, thank you. I got the thumbs up from Bill. Specifically targeting specific SIC codes to attract them over here to Wisconsin, so that once we come out of whatever is going to happen in COVID, we have at least that traction of those companies ready to move over here. Because just because they want to move over here doesn't mean tomorrow they can hop in a moving van, or within a few weeks they can hop in a moving van like a resident, just a private citizen can sell their home and move over here, or put their notice in for rent and move over here. So this program is designed to actually now contract out so that we can let this contract go at any time. And for the dollars that we're spending, all we really need to do over the next year and a half is to get 1 or 2 of those companies to move over here, build a building, and we've made our revenue back. And now not only have we made our revenue back in about a year or 2, in perpetuity we have that revenue ongoing. And so that's the whole point of this. You want to argue that our downtown businesses need a few $100,000 between all of them in St. Croix County. I would argue that the latter is, let's get off their back and let's let people make their choices on whether or not they want to go see those businesses, the ones that are doing the things that are necessary to be safe, and the ones that are going along business as usual. A couple $100,000 that's left over isn't going to make a difference, I can tell you that, as not only owning a business, multiple businesses over the last decade. It's getting commerce back and going, and the businesses out there don't want any more loan programs. Even when I made a few phone calls in my district and said, we have a loan program coming, they're like, yeah, and what else? And so we shot down a resolution that gave some stability to them going into 2021. And I hope that you guys consider utilizing these funds, using the money from St. Croix County, not necessarily the EDC, but as an investment into the EDC to go out and harvest money and revenue for our county and relief for our residents spread across this county. That's the logic, the rationale, and the reasoning behind why we did this. It was not taken lightly, I don't think, Mr. Chair. You and myself and Bob Long discussed it, and Mr. Witt and Bill, Mr. Rubin. We discussed this pretty lengthy, and I think for the intermediate impact, this is a worthwhile investment. And I don't know, that's pretty much all I got. Unless I missed something, I don't think I did, but.
Supervisor Hanson, you want to do?
Those are really, really good goals, and I hope that they work out. But I'd hope that the supervisors hear these numbers. I just want to repeat this because this is really what the bottom line is, that the county contribution to economic development in the last 10 years has been $1,099,963 in one 10-year period, and that economic development right now is holding $313,000 in investments of arguably taxpayer money. Just let that sink in. They already have $313,000 in reserve, and if this is such a grand idea, there is no reason that they can't write a check. They have the money. When we have such a huge need in public health right now, we have a lot of other things to do with this money. I think it's irresponsible to spend any money on an organization that's holding $313,000 of taxpayer money in investments. So please think about that. I think those are great ideas. And we've already paid the money up front to economic development. They can use it as they see fit.
Supervisor Long.
Thank you, Mr. Chair. First of all, there could be very good reason that there are those reserves for the EDC, and maybe from an operational standpoint, it's appropriate, and I don't think we can assume that it is or isn't without hearing from them. And the other thing, as far as this program, we all know we live in a great place. We know that. But all these businesses in the Twin Cities, they may not know that. You have to have some sort of an outreach program to touch them, as Supervisor Burning indicated, to try to help convince them that it's worthwhile considering moving their business across the river. So it's clearly a worthwhile program, I believe. And as far as the finances of the EDC, whether or not they could actually afford to do that through their normal operations we don't know that. And we can't really determine that without working through the EDC. So don't make that assumption.
Supervisor Achterhoff, did you have your hand up? And next
Yep.
will be Robbie.
Kind of agree with what everybody said, except for the fact that I agree it should be tabled, because if we haven't heard from the EDC, we don't know whether they can afford to do the 50,000. And I think that for the economic development, people are going to have a hard time paying utilities, paying rent, and those all can fit in one way or another. So the money would help the citizens of St. Croix County, and if the EDC can afford the 50,000, it should come from what they already have, and then everything will proceed the way people think it will by using the 50,000 from the 500,000. But until we know, I don't feel any of us have enough information to make a valid vote as to what to do with the money, because we don't know.
Hall.
I'll just be very brief. So clearly they do have a cash reserve. They could potentially borrow against that if they feel that this is a very good idea, if it pays for itself. Also, aren't there layers of economic development assistance at the state and regional levels that they could be looked at as well? To me, this feels like, we have some money left over, burning a hole in our pocket. Let's get rid of it. I would rather see it go back in and be thoughtfully applied to something that's going to make a concrete benefit today in a very uncertain time, rather than try to take what I heard Mr. Burning say, take a business from an already economically ravaged area and bring it here. I don't think that's something I can get behind. So I'll leave it at that, but I am not in favor of this at all.
Anderson.
I just want to make one point, that we're elected to serve the residents of St. Croix County, not the residents of other counties.
That's fine. I take that that was directed at Supervisor Hall.
Okay, yeah, that was directed to the chair, and that's, so it wasn't intended, I don't think, at you. It wasn't. Okay, anybody else up there would like to make comments, question? Supervisor Cook.
Thank you, Mr. Chair. I think there is a lot of value in spending money for economic development. As we know, when we bring business to the county, we do benefit from that long term from a tax standpoint. And I do think that the EDC is a good partner and someone we want to continue to expand that partnership with. I agree with the comments that we really don't understand the fund balance that they have and whether or not that's something that's necessary for their operations. On the other hand, I also am a little concerned about the messaging and drawing folks from Minneapolis or the Twin Cities area because of the unrest. That makes me a little uncomfortable. I would prefer that messaging would be focused on the positive attributes of St. Croix County. And so I will be supporting the tabling of this ordinance or this proposal because I think we need more information. I would love to have Mr. Rubin come and talk to us and have a better understanding about what kind of messaging they're proposing or the consultant is proposing and what kind of outcomes we expect from that.
Does anybody else wish to?
Point of inquiry.
Go ahead.
Mr. Chair, if it's tabled, what happens to this resolution then?
Corporation Counsel Cox, would you comment on that, please?
The motion is to postpone indefinitely, which kills it, but doesn't preclude it coming back through the normal channels. For example, through the administration committee again. But it's the motion to postpone indefinitely does kill this resolution, but it can be brought back again in a future date.
Supervisor Otino.
Yeah, I have a question regarding that. The money that's in the system already that we put there is still available for our local businesses to draw off of. Is that correct? Tabling this doesn't kill all that money that we've already set aside, just kills the consulting fee of $50,000. Am I correct?
Supervisor Otino, we allocated $500,000 for the loan program. That loan program closed September 10th, I think it was. And we had 31 loan applications and had doled out $310,000 in loans. So we have $190,000 remaining, but that loan window that we had opened up for 60 days is closed now.
Thank you.
Any further questions, comments? Okay, I guess we're ready to vote on the amendment, which is to table the resolution at this time. So I think...
Isn't it postponed indefinitely? I'm sorry.
I'm sorry, to postpone indefinitely, you're correct. Thank you for that correction. So at this time then, we'll vote. We can do a roll call vote on that. Cindy, go ahead.
I'm going to start at a different name, so. Dave Osnes. No. Scott Counter.
Yes.
Dan Hansen.
Yes.
Scotty Yard.
No.
Greg Telejohn.
Yes.
Dave Peterson.
Yes.
Paulette Anderson.
Yes.
Judy Achterhoff.
Yes.
Shelly Tomschick.
Yes.
Yes. Bill Peavy.
Yes.
Ed Schockner.
Yes.
Sean Anderson.
No.
Bob Long.
No.
Kathy Leaf.
Yes.
Kara Cook.
Yes.
Tim Hall.
Yes.
Paul Burning.
No.
Rick Otino.
Yes.
Bob Fiedler.
No.
6, 7, 8, 9, 10, 11, 12, 13 yeses, 6 noes.
Okay, it is postponed, carries. So, oh, I gotta get caught up. Next one would be the resolution adopting personal policies. Supervisor Long brings it to the floor. Second. Supervisor Ard, discussion.
Yep, I believe we have HR staff on the line to talk about the policies.
Yeah, Audrey Haycraft here from the HR department. So there's 4 different policies that we're looking to propose changes to adopt. The bereavement policy, each one has kind of just a little snippet along with it to show what changes are being made. Bereavement policy mainly changing the family relationship so that it isn't according to the type of family member, doesn't correlate to the amount of time off that you get. We just broadened that out to state family or household members and added a bank of hours for the year that employees can have as paid time off for bereavement leave. Ken, I'm not sure, do we go through, does the vote go through each one separately, or should I go over all 4 of them at once?
Yep, all 4 are on one vote, but we can maybe pause on each policy to see if there's any questions. And the bereavement leave is probably the one with the most significant change in our current philosophy, because that goes to a bank of hours rather than a per relationship basis. Really, and the reason for the changes, the way I see it, is that relationships are so different nowadays between who's close in your family and maybe who isn't. It's not necessarily directly by aunt or uncle. It might be different per family.
Right. Is there any questions on the updates?
Supervisor Hanson?
Could you just describe what the difference between this and PTO is?
Yeah, so PTO is paid time off or personal time off. I'm not sure which. So the PTO is for personal usage when you're ill or when you're going to take a vacation. Bereavement leave is funeral leave. And so when you're going to be attending the funeral or you're mourning the loss of a close family person. And so bereavement leave is, under this policy, it allocates 56 hours per year for you to use. So you could use all 56 hours for one funeral. Maybe you need to travel across the country. But it limits the total number of hours then. So our old policy took into account funeral leave based upon the closeness of the person by lineage. So a parent would get 3 days, a child would get 3 days, an aunt and uncle would get 1 day. So that's the big difference in methodology being applied to funeral leave or bereavement leave.
So are we offsetting this 56 hours, which is bankable? Are we offsetting that with PTO time so that the net bankable hours is remaining the same?
The 56 hours is not bankable, so it's a use it in any calendar year.
So what would be the net impact on budget for the change? Do we know?
I think it would be hard to measure. We don't know exactly how the new policy will be used compared to the old policy. I can probably give you a look back a year or two from now and tell you what that difference is. And it's probably not in a pure dollar format, although I can convert it to one for you, but it's lost productivity. So if you use more time off, whether it's PTO time or bereavement time, then it's work that doesn't get done by the county, somebody else has to do. So it's a productivity issue usually, rather than a pure dollar amount, although we can translate that because we're accountants, that's what we do.
Thanks.
Supervisor Hanson?
I was, and I didn't mean to be super critical there. I thought you were banking that 56 hours, so it looked to me that it was going to be a cumulative thing, and I just want to make sure you're not thinking I'm evil.
Guess we can go ahead and move on if there's no further questions there.
Okay. Then what was the next one on the list? Is it salary admin?
administration, yep.
Okay. So the salary administration policy, not a lot of changes there. We are adding language from memos that were posted in 2016 and 2020 regarding step increases once an employee has completed probation. And we just combined the sections for promotions and transferred, for promotions and transfers, and removed some of the language which correlated to being placed on a higher step, higher than 5%, upon recommendation of the HR director and approval of county administrator. So we removed that language from the policy as well.
Any questions on that section? Seeing none, go ahead and next one.
This is the next inch. Promotional opportunities, perhaps. So I don't have, this is a pretty short little policy. Is there a proposed change on the next page? If you go down to promotional opportunities on the next page there. So Ken, I'm actually not sure there is, if this is a new policy or what the updates are.
I can share that. So this one just changed the introductory period from 12 months to 6 months for a internal promotion. And then it also allows for an internal promotion to negotiate a salary increase that may exceed, like we talked about previously, a 5%. So the current policy only allows for a 5% or the next step closest to a 5% for internal promotions, and this one allows for negotiation between the candidate and the hiring manager.
Questions, comments on that? No?
One other note on this is currently our policy does not allow for a PTO payout for an internal candidate that takes a new position. This policy will allow for an employee that has been with us for a long time to still get their PTO payout, even if they've switched to a new position and are in an introductory period and then they leave during that introductory period, they still are able to get their PTO payout, and that's another change.
Any others? That covered all the changes then?
Yes, I believe so.
Yes, correct.
Okay, questions on any of the changes then? Supervisor Hanson?
Is the general wisdom that it's cheaper to make a PTO payout than it is to have somebody using PTO because it's better for productivity? I'm trying to, I have heard people say that, gee, that's a lot of money you're paying out, but I have always looked at this from the ideological perspective that you get better productivity out of people who are staying at work, and that those payouts are actually a testament to the fact that you're getting a better utility out of that human resource, to make it clinical, I guess.
Yeah, I would say that there's a happy medium between those two. So an employee that never takes any PTO time or vacations tends to burn out more. They're also the ones that you most want to look at for financial misconduct, because when you go on vacation, that's when other people do your work and they find those things. It happens a lot, actually. But we want employees to be refreshed. So they do have to take some time off in order to recharge themselves and refresh. So I would say that it's a happy medium between the two.
And I would concur with County Administrator Witt that from an HR perspective, we encourage people to utilize their PTO. It promotes a work-life balance. And so we definitely encourage that.
Further questions or comments? Okay, I think we're ready to vote at this time then on the resolution adopting personal policies. So at this time, all those in favor signify by saying aye. Aye. And opposed? Motion carries. Thank you. Okay, next would be the annual department reports. They were in the packet. Does anybody have any questions on any of the reports? Okay, did anybody on any of the reports feel they needed to elaborate on their reports? Gail Meyer, go ahead. You have nothing. Okay, you're muted, Gail.
No, I just unmuted myself. I have nothing further to say other than I was requested to make a very brief report. Hopefully everyone, hello, thanks for having me here at the meeting tonight. I'm pleased to be here on behalf of the St. Croix County Fair. Hopefully everybody received their in their packet our official report. I included a little bit of a visual recap of things that we have been doing in 2020 at the fairgrounds, and also included our goals and our request for continued financial support from the St. Croix County administration for improvements to the fair. As I mentioned in the report, due to the uncertainty of the COVID situation this year, we were unable to host our fair as usual, which was scheduled for July 15th through the 19th. However, we postponed everything until 2021, and we'll be using the same theme and our exhibit premium book that was supposed to be this year for next year. But I want to stress that in relation to previous business items, the St. Croix County Fair is a business in our county that does impact the economy of our county. And this is a business that really we do need to try to save. For those of you who do not know, the St. Croix County Fair is a free fair, and it's one of the very, very few in the states that do not charge an admission. So there is no charge to see our exhibit buildings, our barns, our show arenas, our pavilions, or our entertainment. Typically, the fair offers a wide variety of entertainment and activities that appeal to everyone. Our updates, just briefly, for 2020, our highlights do include the completion of our new livestock building, which you may see here in some of these examples. The construction began in the fall of 2019 with the demolition of our swine building and our sheep building. And then we began construction in late September. And we finished out this year. We still have some electrical and things like that for finishing touches, but it should be ready to go for 2021 fair. We have also, by not having a fair this year, it has allowed us to do some projects for cement work, some painting and staining, and repairs and maintenance to some of our buildings and areas that really, really need some attention. Our goals for the future, we always can use some electrical upgrades, like to our campgrounds, where we can provide 30 amp service to campers and RVs to accommodate their air conditioning needs. We would love to be able to resurface the floors in our bathrooms on the main part of the fairgrounds. We would like to improve our office equipment and storage space in our little area there in the highway department building. And a huge goal for us would be to provide a communication system that links every area of our fairgrounds, 41 acres, to be able to facilitate emergency communications and the like. We do, hopefully, we are looking forward to going ahead with our FEMA grant program to provide a community safe room and shelter, which will be provided, built on the fairgrounds, but it will serve the community of Glenwood City. That's pretty much going to be a reality. We're just waiting for some final signatures to get that project rolling off the ground. Just so you know that planning for the fair, it's actually a year-round process. And even though many people don't know this, it takes a whole year to provide for the next year's fair. This year may not have been as intense as normal, but business as usual has not stopped. Primarily, it's a volunteer organization who works daily without office or staff, and our hours are spent planning and preparing for the next fair. It is our sincere desire that 2021 will bring us back to a normal. I want to give a very, very special thank you to the entire county board for your continued support for the St. Croix County Fair. And I want to thank you as well for your continued support. Did I lose you? I hope not.
Thank you. Questions? Supervisor Telejohn.
Yeah, I just want to commend the Fair Board and how much work they do and how many volunteers there are that make this happen every year. I've been sitting on several board meetings now, and it's amazing how much work they get done and with no pay. So just want to make that publicly noticed.
Thank you.
I want to thank you. I want to thank you, and especially Supervisor Judy Achterhoff, who has been very, very strongly supportive. I just really, really sincerely hope that we're looking forward. We kind of postponed this year's fair to next year, so our new fair dates are going to be July 14th through the 18th. We're going to keep our theme, and if you can allow me just a second here. This, if you can see this guy, this is our mascot. So for 2021, we're going to still be moving and grooving at the St. Croix County Fair, and we hope you'll all join us for that.
Thank you. Supervisor Achterhoff.
Yeah, I just have one thing to add. If you don't have it in, hopefully, Gail, you can get it taken care of, but they were unable to have their Mayfair and the rodeo, which are huge fundraisers. So with Smith Auctions, it's kind of taking the place of the Mayfair. So if anybody has a chance, get online to Smith Auctions. But I want to add, click on FSCCF, and that will take you to the items that the fair is to sell that people have donated. And hopefully, Gail, if you can send a copy of that, and it will get posted for all of us.
I'll do that. Thank you, Judy.
Okay. Yeah. But make sure you add that FSCCF to it. I had to call them to find out. So
Any other questions for me?
This is Supervisor Hall. I just want to thank you for your hard work, and family and I love going to the fair every year. So,
Well, thank you. We hope that the situation will improve and we can have a full-blown fair again next year.
Thank you very much. I also understand that Ellen Denzer has a brief presentation on her community development. Go ahead, Ellen.
Thanks very much, Chair. I am down the hall if you need to talk to me in person, but otherwise I would just say that we tried to cover all of the things we were able to accomplish this year in our report. Tried to illustrate it with a lot of graphics and photos, and hopefully you found it helpful and informative. And considering the time, I will ask any questions.
Any questions for community development? Supervisor Hanson.
I'd just say, I know that sometimes it's easy to gloss over these reports, but it's completely and totally impressive if you take just a moment and read just the goals, objectives achieved from the Community Development Department in this report. It's astounding the amount of things that this staff is able to do, and I commend them in the strongest possible terms. Thank you very much, Ellen.
Thank you, and I would say that I totally agree with you. Our staff are incredible. They work extremely hard, and even in 2020 with the limitations from COVID and quarantine, our list is going to be just as long, if not longer. Thank you.
Thank you also for doing such a good job. Thank you. Any other questions?
I could, as for extension, if I could just give a brief report.
Yes, go ahead.
Thank you. My name is Kristen Bruder. I'm the area director for Extension. Just want to just take a brief moment to take this opportunity to thank you all for your continued partnership with Extension. Our educators tailor programs to meet the unique needs of St. Croix County, and we work alongside our county partners such as yourselves, schools, organizations, families, and youth to bring the unbiased research-based information to the St. Croix County community. Your continued support has allowed us to build partnerships and achieve outcomes that benefit the people in the community where they live and work. The 2019 annual report that you have before you gives you a snapshot, just a snapshot of the programs offered in St. Croix County and the outcomes achieved in 2019, along with the goals of 2020 and an overview of our budget. Your investment in Extension not only gives you access to our 5 programmatic institutes, but also brings you statewide services, such as the federally funded FoodWise program and the state specialists. Each program area continually assesses the community in a variety of ways to determine what needs are most crucial to address. They write their plans for the year and include outcomes they hope to achieve. We understand, however, that there are circumstances in which the outcomes they work toward may take a new direction, such as the national pandemic we're currently in. COVID-19 has affected all of us dramatically over the last 7 months. Our educators continue to adjust and move programming to online platforms, assist departments, and engage with audiences through a variety of creative ways. You, as our county partner, are crucial in determining what needs the people of St. Croix County are faced with. We welcome your input. We invite you to visit with our educators and attend programs to better understand our work and assist us in connecting our resources to the people of St. Croix County. If you have questions or would like to learn more about our work, please contact me anytime. I'm always available, and I thank you for your time this evening.
Questions, comments? Okay, thank you for your work. At this time, then we'll proceed on to requests for future agenda items. Supervisor Burning.
So I was wondering if we could have the admin committee look at the possibility of taking some of the CARES money. I know if there's any money left over for our libraries throughout the county to help remodel the bathrooms and drinking fountains to be more COVID compliant.
We'll refer that to admin, and we'll take it up. I believe Supervisor Long will take it up, I should say. Chair Long. Other ones. Supervisor Octroff.
Yeah, I don't know if it has to go to a department or how it's done, but I would like some comments about the broadband. Because I don't know if it all has to be private business. I don't know what the county can do, but it would be nice to have an explanation to the full board. It may have to go down to a committee, but it'd be nice to start off with, okay, these are the options or these are the possibilities. And then it might help us to figure out where we're going to go or if we want to go anywhere.
Ken will look into that, and also the state did come out with some incentives. I assume you saw that on Wisconsin counties, and yeah, I encourage us all to take a look at that. I did put it out to the local communities. I forwarded that so that they could have a look at it, and they were aware, because there is a program where they can apply, and I believe it's closed now, but there will be help for communities getting ready for broadband, so hopefully that'll all help. Oh, and we did apply. Yeah, admin will take that up also. Supervisor Long is be more than pleased to have a look at that. Any other agenda items? Okay, seeing none there, we'll go on to the county clerk's correspondence and rezoning requests.
Sure. I have no correspondence or rezonings. Just a reminder that October 14th is Committee of the Whole at 10 a.m. here. County Board is November 3rd, which is also Election Day, and that's at 8:30 in the morning. And then right now I'm just going to put a little plug in for municipal clerks. They're really busy right now. They're doing their best to keep up with the election demands, and so if you feel to do so, just give them a thanks. They're busy. So, thanks.
As chair, I'll take this opportunity to thank you, Cindy, too, for the fine work your office is doing, and I also want to give a shout out to the Health and Human Services Division. They've been, I'm sure, just overtaxed for the last 2 months, and I just want to say I think they're doing a great job. So on that, then my next would be announcements. Ken.
Yeah, just one, Cindy stole a little bit of my thunder. Committee of the Whole next Wednesday. I have your budget books here, so you can take your paper copy with you. The packet will come out in the next day or two with that in it in a digital format. And then the members that are online, I will put your book in your mailbox. So if you stop anytime before next Wednesday, you can pick that up.
Supervisor Hanson.
Do we give any consideration to changing the county board meeting in November so that it doesn't fall on the election day?
No, there has been no, I guess, concern raised about it. I guess I'm thinking in the back of my mind that a lot of folks are doing mail-in voting, I'm guessing, so I'm not sure.
I'm working the polls.
And it is a morning meeting, by the way.
Is anybody else, could you poll the supervisors and see if anybody else has a concern besides me?
Anybody feeling concerned about voting day and I see no others, so Dan, so
No, I do also, Mr. Chair.
oh, okay, I see two.
Yep, this is Supervisor Peavy.
Go ahead, Supervisor Peavy.
Yeah, I have a concern too, since I'm clerk. It's a real conflict for me to get to Hudson by 8:30 and get the election started. So I also have a concern.
There's a budget notice out that's when we're meeting, but so. If I promise to keep that meeting short somehow, would that help? Bill, you could zoom in, right?
I wouldn't zoom in for a budget. No, I would show up. That'd be my plan if my foot heals by then. So, if we could start at 9 instead of 8:30, it would make it easier for me. But that
Are there?
whatever works for everybody else.
Okay, I'll poll the troops here. Anybody object if we move it back to 9 to make it a little easier for the? Okay, 9 o'clock will be the next meeting as approved by my fellow supervisors. We'll keep the meeting as short as we can, although it is a budget presentation, but I would hope that at our committee of the whole, we'll have all the questions and so forth answered then. So on that, my note also will be to the board members. I appreciate you and staff. I know that nerves have been frayed the last month or two. Thank you all. Let's all remember we're in this together. We're working together. We can disagree, but let's disagree with respect for each other. So thank you so much again. Jim, did you have something you wanted to go ahead?
Yeah, one quick one. I'm sorry it's going to take it a little bit longer, but on October 20th, Dan Inlow, who's been in my department for over 23 years, is retiring. He's the guy that sets his room up every day and for you guys and all the other meetings. So if you see him in the hallway, grab him, give him a hug. He's actually moving to Missouri to be closer to his family.
Oh, nice.
Thank you, and please extend our gratitude to him and our best wishes. Okay, at this time, I'll adjourn the meeting at 8:02. Thank you again.